Welcome to The Explainer. Today, we're diving into the world of tube feeding. Now, I know what you might be thinking, but this is a medical intervention that's way more sophisticated than it sounds. It's really a cornerstone of modern nutrition that saves lives by working with the body's natural systems, not against them. So let's break down how it all works. You know, this entire field really boils down to one single crucial question. What do you do when someone just can't eat? Maybe they can't swallow or they're too sick, but their digestive system, their gut, is still working just fine. How do you get them the fuel they absolutely need to heal? Well, the answer comes down to two very different approaches. On one hand, you have parenteral nutrition, or PN, that bypasses the gut completely and sends nutrients right into the bloodstream through an IV. But on the other hand, you have enteral nutrition, and that's our focus today. This is all about finding a clever way to let the gut do the job it was designed to do. Okay, so you've got these two paths, but how do doctors choose which one to take? Well, it turns out there's a really powerful guiding principle, a simple philosophy that honestly just respects how incredibly well-designed our bodies are. And this is it. If the gut works, use it. It's the golden rule. And here's why. Think of your gut lining as this super secure border wall. Its job is to let all the good stuff, the nutrients, pass through, while keeping trillions of potentially harmful bacteria safely contained inside. If you bypass the gut completely, that wall can start to get weak and bacteria can sneak across into the bloodstream, causing all sorts of serious infections. So keeping the gut active keeps that vital barrier strong and healthy. So when you add it all up, the benefits are huge. You're not just keeping that gut barrier in good shape, you're also dodging the serious risks that can come with IV lines, like those nasty catheter-related infections. And on top of all that, it's usually cheaper and way simpler to manage. It's just the smarter, safer play whenever the gut is an option. Okay, so we've decided we're going to use the gut. Great, but how exactly? You might be picturing just one kind of feeding tube, but there are actually a few different ways to do it. And the choice almost always depends on the timeline, how long the patient is going to need that support. It really all comes down to this one question. Are we talking about a short-term fix, or are we settling in for the long haul? Is this support needed for a few days, a few weeks, or is it looking more like months? The answer to that question completely changes the entire approach. For any short-term needs, and by that we usually mean less than a month, the go-to is a nasogastric tube, or an NG tube. It's just a thin, flexible tube that goes through the nose, down the esophagus, and into the stomach. It's super quick and can be placed right at the bedside. But if we're looking at longer-term support, a gastrostomy tube, often called a PEG tube, is the way to go. This is a port that's placed directly into the stomach right through the abdominal wall, which makes it way more secure and comfortable for extended use. But there's always an exception, right? Some patients might have a stomach that doesn't empty very well, or they might be at a high risk for aspiration. That's when stuff from the stomach could accidentally go up and into the lungs, which is really dangerous. For these patients, the tube can be threaded right past the stomach and into the next part of the small intestine, the jejunum. It's a great way to add an extra layer of safety. All right, so we've got the delivery route figured out, but what exactly are we sending down these tubes? Now, it's tempting to think it's just a fancy food smoothie, but the reality is it's a whole lot more sophisticated than that. These are scientifically engineered liquid meals. For most patients who have a healthy, functioning gut, the standard choice is something called a polymoric formula. The best way to think about this? It's like a complete, perfectly balanced meal. I'm talking protein, carbs, fats, the whole shebang, all blended into a liquid. All the complex nutrients are there, totally intact, just waiting for the digestive system to do its thing. But what if the digestive system is a little sluggish? What if it's not really up for doing all that hard work? That's where oligomeric formulas come in. If the polymeric formula was a blended steak dinner, this one is like that same dinner has already been pre-digested. The nutrients are broken down into much simpler forms, which makes them super easy for a compromised gut to absorb with minimal effort. And it gets even more customized from there. These formulas can be fine-tuned like high-performance engine fuel. You can get calorically dense versions for patients who can't handle a lot of fluid, high-protein formulas for critically ill patients who need it for healing, and even versions with added fiber to help keep things moving. There are even highly specialized formulas out there designed for very specific diseases, like kidney failure or diabetes. Now, this all sounds pretty straightforward, but of course, it's not always a perfectly smooth ride. There can be some roadblocks. The good news, though, is that the most common issues are really well understood. And even better, they're often totally preventable with the right care. So what's the number one most common, most frustrating mechanical problem? A clogged tube. Seriously, it can be a real headache, and it most often happens when giving medications. But like I said, there's a very simple and super effective protocol that pretty much eliminates this risk. And the protocol itself is so simple, it's almost like a little dance. Flush, medicate, flush. You start with a water flush, you give one medication, you flush with water again, you give the next medication, and you finish with one last final flush. It's that easy. This simple routine keeps the line clear and also stops different meds from mixing and getting gummy inside the tube. And here's another super simple but absolutely critical practice: patient positioning. Just keeping the head of the bed elevated to at least a 30-degree angle is a powerful, totally non-invasive way to use gravity to your advantage. It helps stop the formula from backing up out of the stomach, which dramatically reduces the risk of aspiration. It's simple, but it makes a huge difference. And this is a really important point to remember. For so many patients, tube feeding isn't forever. It's not the destination. It's the bridge that gets them back to health. The ultimate goal, almost always, is to get back to the simple, universal pleasure of eating food. Seeing that transition begin, that is a huge milestone in a patient's recovery. As they get stronger and can swallow safely again, the team slowly dials back the tube feeding and starts introducing food by mouth. It's this carefully managed handoff, making sure the patient is getting all the nutrition they need as they transition from medical support back to normal life. So all of this leaves us with a pretty cool thought to chew on. We developed these incredibly precise liquid diets to help heal the sickest of patients, but in the process, we've learned a ton about what the human body actually needs to thrive. So as we keep unlocking the secrets of the gut's role in our immunity and our overall health, you have to wonder, could the lessons we've learned from tube feeding one day lead to perfectly optimized nutrition for all of us? Thanks for watching.